Sorry, folks, just getting organized. What's going on today?
Morning, Cindy.
Good morning.
Oh, good, she can hear us, good.
Now I can hear, yes.
All right. Well, good morning, everyone. Sorry, I'm a little late in calling the meeting to order, but we were worried about quorum. So we do have quorum. So I'm going to call the meeting of the Richland County Community and Health Services Standing Committee to order. Today is September 4th. It is 9:34 a.m. And let's see, that should be it. Roll call, please.
Miller. Here. Kramer.
Here.
Engel. McGuire. Barris. Braithwaite.
Here.
Chicker.
Here.
That's four for ma'am.
Thank you. And we have verification of open meeting law compliance.
It's been posted for ma'am.
Thank you. And I need approval of agenda.
Also move.
Second.
Thanks. And has everyone had a chance to look at the minutes from August 7th meeting? I'm sorry.
To the vote.
Oh, I'm sorry. All those in favor of approving the agenda, say aye.
Aye.
All those opposed? Sorry. I'm trying to hurry up and through. All right. Has everyone had a chance to look at the minutes from the last meeting? Is there any changes, additions, deletions, questions?
I wasn't here, so
Oh, okay.
but everything looked.
All right. Well, hearing no corrections, additions, deletions, we will approve those as written. Do we have anyone with public comment this morning? Anyone online have public comment? Okay. Hearing none, we'll move right along. The election of committee chair and vice chair. Do we want to do that today?
I think you're the only county board member here, so,
Mary.
oh, and Mary, so, I'm wondering, do you guys feel like we should move that to next month?
Let's move that.
Yeah. So consensus.
Want to give Dan a chance to. All right. We're going to go down to reports. HHS Director, Administrative.
Good morning. So, did everybody get a chance to take a look at the report? Did anybody have any questions or anything that stood out to you? Is there anything you wanted to highlight? Okay. I don't think there was anything too out of the ordinary. In the ADRC, we did get an extra $5,000 in funding to do a revitalization of our congregate sites. So we are doing a Rise and Dine program, serving people over 60, and that'll be at the Phoenix Center on Fridays in September from 8 a.m. to 10 a.m. And if people are interested in going to that, they could just reach out to the ADRC to sign up. So we just need to have people sign up by the day before. So it'll be a breakfast buffet. So we're excited to be able to offer that. Behavioral health has had a couple of new staff start over the last month. And all of their numbers are there for the crisis and for each one of their programs. If anybody has any questions there. Child and Youth Services, they've got 31 current open cases. I don't know, Brittany is on. I don't know if there's anything you'd like to highlight, Brittany, for everybody.
No, nothing significant. I think it's all pretty well written there.
Yep. And then public health as well. So health, Brandy is on as well. Was there anything that you wanted to highlight, Brandy? Other than that, and I think economic support as well, everything is in there, but, oh, Brandy, are you there?
Sorry, my mic was, I couldn't unmute. I really don't have anything specifically to highlight, just to note that there are some measles cases in the northeast region of our state reported specifically in Alconto County. So just keeping those trends on our radar, and we currently have none reported for this county. Thank you.
Thank you.
I have a question. For the vaccines that you got for children and adults, September 25th and October 23rd, does that include COVID as well, besides the flu shot?
Yes, that's a good question. We do have the most up-to-date recommended COVID vaccine for VFC and VFA. So that for the people that have no insurance or are underinsured, we're able to offer that. We cannot offer it as a billable vaccine. People would have to go to the clinic if they have insurance coverage for that.
Okay. I have another question for you. For the adults and the children, if you've had the measles or you've had the vaccine, but it's been many, in my case, probably about 40 years ago, do I need to vaccinate myself against the measles that are going around now?
Yeah, so that's a good question, and I just highlighted this, and I think also Dr. Wright did a great job explaining it on the morning program for WRCO. But if you were born before 1957, we say no, because theoretically you're already exposed to measles and likely have immunity. If you were born between 1957 and 1988, then maybe you would have probably received one dose. And then some vaccines used from like 1963 to 67 were inactive. So it might be worth checking with your healthcare provider on that. If you were born in or after 1989, that's also a maybe, but you likely had 2 doses and probably don't need a booster. However, if you only received 1 dose, and like if you fit specific categories, like high risk groups, then you might want to talk to your doctor about getting a booster dose.
Thank you.
You're welcome.
Anything else, Roxanne? Okay. Moving on to the expenditures report, vouchers and expenditures over 2,000, but less than 10.
Yep, so nothing really stands out outside of normal business that we do. I don't know if anybody had any questions about anything that was on the report, but it's pretty much just standard stuff that is out there.
Any questions from the committee?
The drivers in transportation are volunteers, right?
Yes,
What expense other than gasoline is on that?
so they actually get paid a mileage. They get the federal IRS rate.
Oh, okay.
So they get mileage and meals.
Oh,
Yeah.
thank you.
What is that federal rate?
70 cents per mile. It varies every year. So the federal government puts out, or the IRS puts out the rate for the next year in December, and sometimes they update it in July as well. So it has consistently gone up. I think when I started, it was 53 cents a mile. And so over the last 10 years now, it's up to 70 cents per mile.
I cited it was 56.
Yeah.
Thank you.
Yeah.
Moving along, unless somebody else has any questions, we're going to go to the budget summary and Richland County placement report.
So if you look, everything's pretty well in line of where we should be. We should be at 58% or below. The biggest one that you'll see outside of it is our CCS costs, and then also our children with disabilities costs. Those are the 2 main ones that have gone over. However, those are more of a pass-through, so they're Medicaid funded, so it's not something that's tax levy related. And then if you see what our current budget balance is, it's got a negative there. However, as revenues come in and other funding sources come in, we don't expect it to be that at the end of the year. So we usually see it be negative, and then it continuously moves towards the positive by the end of the year. So right now, there's not really any concerns with that.
Any questions, anyone?
Then if we scroll down to the placement report, placements, we are still doing okay as a whole as far as what our county expenses are for both our adult and children's institutional costs. So those, we don't really have any concerns there either, you know, but one bad month can really swing that to where we are concerned. So, but so far this year, we've had probably a record number of people that have been institutionalized. However, our costs have been lower because their time in the institution has not been as long as, you know, it's only been a few days here and there. Okay, Brandy. So, yeah, so we're doing well on the placement costs as well this year. Which is good. Any questions on those? We do have Brittany and Brandy that are here that can speak more to both of those funds or placements if you have any questions.
Are these people that are placed, actually, I'm thinking Medicare. But if you have people placed like this and there's from the time they go in until they actually pay, is that included in this or?
So these are generally pretty much all tax levy costs. So when people end up institutionalized, it's court ordered. And so that's a mandatory county cost. However, that being said, individuals up to 22 and over 65 can potentially have part of their stay paid for by Medicare or other funding sources as well. So this actually doesn't, we recognize, you know, what individuals have paid once we actually physically receive that payment.
And there are different facilities, so we always, if they go to more of a hospital inpatient setting, their insurance is more likely to cover that. So if we were to send them to like Gunderson or UW to their psychiatric facility, but if they were to be sent to like Winnebago or Mendota, then insurance won't cover those because they usually go inactive during that time.
So actually, the senior citizens waiting for nursing home placement or whatever are not your biggest issue.
No, and it really is, and their mental health commitments is what they are.
That was what I wanted.
Mhm. So as you can see, you know, we're at, for our children's fund, we're at 44%. And then for our adult, we're at 28%, and we should be right now at about 58%. So both are significantly below where we would expect to be for the year.
But again, that can change in a heartbeat.
That can change with one individual that maybe is very, very ill. So
Do we have, and how many do we have? Some, say that one that costs so much money, Wisconsin, for the mentally ill, you know. or-
oh, so Winnebago or
Winnebago.
Mendota.
How many are we supporting right now?
Currently, at this moment, we have one at Winnebago and one at Mendota. One at Mendota comes home today, actually, so then we would just have one county resident at Winnebago. But this year, we've had, I want to say like 26 around there, emergency detentions that have gone to facilities versus last year we had like 24 total. So we are hitting record-breaking numbers this year.
It's still within a range. And 2 people.
Yeah, and if you think about it, again, you know, we could have just 10 people, and if they are very ill and they're in for a long period of time, they could be more expensive than what we have now. Because what Brandy is seeing is that individuals that are going for less amount of time. So it really isn't so much about how many people, it's about how many days people are there. So,
Okay.
yeah.
But it's good because we're coming up on our busiest time of the year. The holidays are always when we see more mental health crisis and things like that. So it's good to see that we're so below at this point in the year. Like December last year, we had 12 people that got hospitalized in 1 month, so.
Any other questions?
I see this, the the placement funding comes out of Fund 54, is that correct?
There's Fund 44 and Fund 54.
Do you maintain a balance on that? Is that 44 or 54?
So adult is Fund 54, and then the children's placement fund is Fund 44.
Okay.
So they do maintain, you know, if there's still money at the end of the year, right now that rolls over, so we have a healthy fund balance. Because one bad year can, you know, we don't want to have to go back to county board and ask for money, right? So having a fund balance is a good thing to have.
Okay.
Mhm.
Okay. Thanks, Roxanne. Thank you. All right, HHS contract monitoring.
So if we look at that, for the most part, all of our bills through July are in. So we're not seeing a big concern with any of our contracts. There is a couple that are gonna come later in the agenda that we need to, have you approve, and then we'll move them on to county board for approval. But really, other than those, we're not seeing a whole lot of concerns. So there was one for Red Maple that's at 61% as of May, but we don't have anybody in that placement currently, correct?
That's an outpatient CCS
Or out-
provider,
So you
but we're bringing that next month.
Okay, we're bringing that next month, okay. So, yeah. And then Roots is one of the ones that's at 82%, but that's on the agenda to be approved to increase. And then Brandy, I don't know if you want to speak to Shay, that's through May as well.
Yeah, we stopped using them, as providers for administrative reasons. So there will be no more expenses for them through the remainder of the year.
And then later on, we've got one, Bakari, Center for the children's unit, and that one will be later on the agenda for you to approve. But otherwise, no, everything else looks okay.
And I see Diane's adult family home is at 66.89%.
Yeah, we're just watching that one and we may have to bring that one back as well. We just have one individual place there.
Okay. Anybody else have any questions? (2026) Health and Human Services Budget Update.
Yep, so, County Administrator had asked Director Ron Felt to make some more adjustments to the budget for 2026. There had been a request to decrease tax levy for the agency of $25,000 for the year, and then also make a change to the placement funds as well. So Stephanie did go ahead and do that, and so this is what the new budget looks like. It sounds like she hasn't heard anything back related to that, so this looks like what it will potentially be for 2026.
The only thing I could see here is that slight increase in the economic support unit, but not a whole lot.
And most of those, any increases you see is cost to continue, you know, for staffing and so forth, so.
Anyone else have any questions on the budget? Moving on to the HHS organization chart. Has this changed at all from last year?
So yes, we have some openings. We are asking for some changes as far as for 2026. But so we usually go through each one. So if we want to go ahead and go down to the next, nothing's really changed on that as far as how many positions. And then the next one shows who the managers are and supervisors are. So we can go ahead and there's not any changes to that right now. We do have a lead worker in economic support right now that I see is not on there. But then we can go ahead and go to the next page. So Kaylee Levy is our new business and financial services manager. We do have, a fiscal specialist that will be leaving next week, I think, is next Friday is her last day, I think. So we will have an opening there. And then we also have a vacant part-time lease secretary. So, we do have that. So that's the update for that one. Otherwise, everything else stays the same. Go ahead, go to the next one. For the ADRC, there's been no changes there. So, well, actually I lied. So we actually did add an on-call temp casual nutrition driver. So that way, we have more depth if we have somebody that calls in. So we did add that position. So we now have 2 of those. The biggest thing with that is that they don't both work at the same time. It is just a call-in basis. So it's no increased cost. And we do now actually, we have 1 vacant temp casual driver. However, we do have another driver that is wanting to retire, but she has agreed to stay on until we find another driver. So go ahead and go to the next one. Behavioral health. So this one, Brandy has a couple of new staff. We are still needing we have a vacant mental health therapist position. And is there anything you want to add to that? Otherwise, I think it's all pretty much the same. They've added in our new staff, it looks like.
Well, I think I am missing our recovery services coordinator in the mental health outpatient.
So we will get that added to the next one. But otherwise, everything else is pretty much stayed the same in that unit. Go ahead and go to the next one. Child and Youth Services, so we do have a vacant supervisor position. They are looking at what that will look like going forward, and we will have an opening as for one of our social work CPS positions. One of our staff there is leaving this month. So we will have an opening for a social worker as well. Go to the next one. Our economic support unit, again, pretty much has stayed the same, but we do have 2 openings for economic support specialists that we are currently recruiting for. But otherwise, and you can see we do have that lead worker is listed on this page for our economic support services lead worker, which is Mandy. Next one. No changes there. Is that all we've got, I think? Good.
Any questions?
Can I go back and ask you, what are these, like back here on, I was looking at this at home, economic support groups, are these people, do they have degrees and stuff underneath? Or are they just people from the public that learn the job, or?
Both. It's not a required degree. So we do have people that may have like an associate's degree or something like that, but otherwise they're trained. They go through intensive training though. Their training is very, very long and very specific to the jobs that they do, so.
So they can't just come in off the street with just nothing and take the credit course and be employed by Richland County?
I mean, we can hire people that don't have a degree for that, you know, I believe we require a high school diploma, and then they look at what is their experience look like. It's experience plus.
Quite an opportunity for young people then,
Yeah.
if they wanted to be in healthcare.
Yeah.
Thank you.
I don't think Brianna's on to answer any other questions, but that's my understanding. So, yeah.
Number 9, discussion and possible action. Resolution approving provider contract amendments for 2025 with Health and Human Services.
So this one is Brittany, so, for Bakari Residential. So Brittany, do you want to go ahead and explain this, please?
Yeah, so previously we had a youth placed at this residential facility, and unfortunately we went over the allowed amount, so we are just requesting the increase to 125,000. We do not have anyone placed at this facility at this time. That youth left in May, but since we are over the allowed amount, we just need to increase it in case we do need to place someone else there in the future.
And the Roots Residential?
Roots Residential is an AFH. I have it, it's actually located in Racine, Wisconsin. On that sheet, I accidentally put Madison. But this is a CCS facility where we have 3 individuals, I believe, in our CCS program staying there. We are projected to go over budget though, because we did have sort of a respite situation where we sent someone there while we were looking at alternative placement for them. So that caused that contract to go up a little bit. But now we're back to just the two or three individuals that reside there.
I believe we need separate approvals for you can combine the Bakari and the Roots together, and then one for resting. Is that right, Brandon? Believe. So those 2 you can approve together.
The one that's on here now.
Yeah, so the Bakari that she was just talking about, and Roots that.
The resting is its own agenda.
Yeah.
Yeah. We're still.
So, yeah, so we would need approval of
This one.
And there is nobody in social service, no place in here where that $20,000 can come from. If this person was placed was in-house under another area,
under another program.
yes. Is there any money to place over there rather than ask the county to pay for it?
So the county is responsible for placements. I don't know, Brittany, where's the funding for this? This comes out of your placement, right? Your placement fund?
Yeah, it comes out of our placement fund. We also, when we place kids or youth, we can, if they get Social Security benefits, or we can request child support from the parents to kind of offset the cost of that placement.
Yep.
If they're getting paid for this child, why
Right.
should we? It's money.
Right, and so that's what they do. So if there's a child that is in placement, then, and if there's any Social Security benefits received for them, and child support, that comes to the county.
Okay.
Right, so we will need a motion to approve that this go to county board.
Oh,
I move to pass resolution number 25.
Thanks, Cindy.
And we need a second.
Okay, Gary, go ahead.
I will.
Okay, thank you. All those in favor?
Aye.
All those opposed? Number 10. Resolution approving a provider contract for the Health and Human Services Department. And this is the other one that we're talking about. Stephanie.
This one is Brandy's.
Yeah, so we have an individual under protective placement and they're in our CCS program. They were residing at a facility. The facility gave notice, so we had to work on finding another facility that would take this individual in. We found a group home at Resting Residential. It's in Madison, Wisconsin, that have agreed to take our consumer. So we're looking to go into a contract with them.
Is it gonna be more money? Or just
It's-
a change?
I think it's $600 a day cheaper than her previous placement, yes.
Oh, wow. Okay.
Oh, yeah, they're, yeah.
So we were really lucky to find a place that would be significantly cheaper as well.
$600 less, so $1,200 a day.
It's way more than
Yeah. So we're down to 600. What is the actual cost for the?
her previous placement was $2,800 a day. So we're down to $2,100 a day.
The one thing.
But a big portion of her comes out of CCS. She's in CCS, so we're able to bill a lot of her fare to the CCS program. So it's not all.
Half of it?
It's probably more than half.
Probably
It's
more than half. We don't start having to see her cost in the placement fund until later in the year. Because most of it is a lot of it is Medicaid.
Are we talking a day?
Yes.
We're taking a month.
A day.
I know, I can't
It's
process.
a day.
I can process a month, can't process a day.
There are some very, very ill individuals in our county. And so if you figure like Winnebago mental health is just under $2,000 a day when people have to go to Winnebago. And these are court ordered placements. So they're very expensive.
And they do pay, that since most of the individuals in our group homes have social security, they also pay a portion each month to Health and Human Services for room and board. So the county's not responsible for the whole amount, just so.
Okay, tell me just now. We know all the specs. What's the price to us a day?
I am not 100% sure how much gets billed to Medicaid and then how much the county pays for each day.
So what happens is it's a pass-through through the CCS program, which is through Medicaid. So that amount goes through Medicaid and is paid through the Medicaid program. And then later in the year, and I don't know when they started putting it towards a placement fund, it was August or September, it goes into our placement fund. There's another process called WIMCR that Stephanie talks about from time to time, that we then, any services that we pay for these different programs ends up going through what's called the WIMCR process. And then we're able to recoup money from that process as well. So like last year, the county received, or HHS received, it was a couple $100,000 back. So there are other ways. So it's really hard to say, oh, this is what it ends up being a day until that whole process is recognized. And then they can go back and say, okay, this is how much that placement actually costs the county a day.
So we must have had someone in here last year in this program. And we know how much it cost by now. What was that?
So the WIMCR actually does not come out until December. We won't know our final numbers for last year until probably December of this year. Because they go through that process, they start in March, I believe, and they have to there's multiple steps to it, and then it gets submitted in July, and then the state goes through and they reconcile that, and then we receive payment usually in December. So that's something though I can ask Steph if you wanted it on a future agenda.
We'd like to know where that comes in our final budget,
Mhm.
how much we get back and how much we paid. I think people deserve to know that.
Yeah.
But now we don't always have people in this program, right?
Right. It just depends on the individuals at the time. If we have somebody that's very sick and needs that level of placement, then, and it's court ordered, then we pay. It's not like it's for anybody in the community. It's for individuals that have been deemed that this is necessary and the courts have ordered it. So,
But would you say 50% of the time we don't have anyone in that program?
well, I wouldn't say it's a program thing. It's that cost of a placement.
Or please-
Yeah, I would say we don't generally see placements this high.
No,
This is more of an outlier.
because of the needs that place has to meet for her.
I understand.
Yeah.
And that.
Yeah, it's, I mean, people, it's shocking when you hear those kinds of
Oh.
numbers. It's shocking.
Because
But-
the last time I heard, Winnebago was $1,500.
I believe it's
Okay.
1995.
So it's up $400, and that's I've only been on this board 2 years. That's a big jump.
They just actually released the numbers for 2026 that came out this week, and it's gonna be like $1,756 a day for
So it's gonna-
2026.
It's coming down. Okay.
That'll be for Winnebago and Mendota, both are those costs. But then there's also special add-ons. If you have somebody that needs one-on-one care, then they can charge us an extra $400 a day for that individual, so.
That's a base amount, yeah.
It is, but nursing and oversight in those places is absolutely necessary if they're that sick.
Right.
$400.
Yeah, sorry. I never like to shock people like that.
Well, I'm just thinking as a senior out here living in Richland County, these bills are going up like that. You know, the people living on an income.
Right.
You know, unless they're on social security, well, even if they're on social security, some don't get very much money. Right. So people,
Yeah. Yep, so Brandy needs approval for this. It actually does save the county, like she said, about $600 a day, so that's.
well, I make the motion that we do it. But we have to do it.
Yeah, and I'll second it.
Okay.
Choice.
Any other discussion?
It's stay healthy mentally.
Okay, all those in favor to take this in front of the county board? Say aye.
Aye.
All those opposed, same sign. Okay. Thank you. On to the TAD grant for treatment and diversity grant.
Every year at Health and Human Services, we bring up the Treatment and Alternatives to Diversion Grant, our treatment court program. We've been working with community stakeholders like law enforcement, the courts, the district attorney's office since 2017 to have our treatment court program. We have 2 treatment courts in Richland County. We have sobriety court, which is for those with alcohol-related offenses, and then we have our drug court, which is for those with substance use offenses. Treatment courts an evidence-based program to help reduce recidivism, keeping individuals in the community, providing them with intense supervision, treatment, and monitoring, as opposed to incarcerating them. Our treatment court grant totals $173,333, but that does require a county match of $43,333. So we're asking for your approval for this. Of the $43,333, $36,351 ends up being an in-kind amount, which means money that the county is already paying. So different salaries of the sheriff's deputy that sits on the treatment court team, victim witness that sits on the team, me when I go sit on the team, all of those expenses count towards our match, but they're not actual tax levy because they're already being paid by the county. Any questions on that?
Is there any change in that from this year?
Nope, this has been we've had the same budgeted amount for the last 4 years, I believe, the same, county match. So everything's the same as the last few years.
Anybody else have any questions on this? If not, I need a motion to approve, to take this account forward.
I so move.
All right, I'll second it.
Yeah. Any other further discussion, questions? Hearing none, all those in favor, please say aye.
Aye.
All those opposed,
Aye.
All those opposed say no. We moved on to town board. Anyone have any correspondence?
Not that I'm aware of.
Future agenda items. We're going to add the election of committee chair and vice chair for next month. Is there something else?
I will also bring to staff the discussion of those high placement costs and the breakdown of the actual cost to the county. So I've got that written down. I'll talk with her about that. So we'll get that put on there. And then, Larry had wanted discussion about the mental health services and, I believe any budget implications from the federal government. So I think that will also be on a future agenda.
Yes. Because he couldn't be here today.
Right. And you've got all that, Miranda? Awesome. Thank you.
Election committee chair breakdown of placement costs.
Anyone else want anything in next month's agenda?
I just want to say thank you because, a lot of department heads come in here and they're not fully understood. I think the sound system we have is nothing more than a Christmas tree ornament. And for a person like me, I have tinnitus and hearing aids doesn't, all it does is elevate the noise of the tinnitus. But I can hear you, you speak clearly and you speak loudly. You still have your cheerleader voice from high school, don't you?
I don't know about that. I grew up with a hard of hearing grandmother and she always taught me to enunciate and speak clearly. So you can thank my grandmother for that.
Well, I really appreciate it. What you say is important to all of us.
I kind of wonder too, why we aren't using, when I'm in Arizona, I have a heck of a time hearing out there and I don't know who's talking. It's just been, can be really frustrating to have your thing here, like this, trying to hear, doing everything you can and it's on high. Why aren't we using these
Oh, the microphone?
microphones like we used to use for these meetings?
I think when they put in the new sound system, we weren't supposed to need that, but I think that's something good. I'll give that feedback to Director Renfeld and I think maybe Miranda, could you mention that to Derek too?
I don't think you just look above you, the pipes are, I think it's on the beam, literally above your heads.
Oh,
Oh, yeah.
That's supposed to pick up, it's an MIS.
I think it's true with county board meetings too. It's
Yeah.
not to be brought up here, but or about the county board, but it's very, very hard to hear when you get a group of people in here. And you're
I
out,
think there's a fan running or something here too.
yes, it's very hard and I just can't understand why and if you watch it on YouTube, it's the same thing. So it's an issue.
I'm having no problem at all hearing you. And I'm on my phone.
Well, we're right under the thing here, but I have a hard time hearing some of the people that are talking, even in here right now.
Oh, that are online. So that they.
No, I mean here.
Oh, in here. Okay.
I
This cheating was particularly difficult for me to hear. I don't know what's different this time, that maybe people are just naturally speaking louder. I don't know, was it you that we talked about the meeting last time, how we had difficulty hearing? So it's a problem that's kind of out there.
Okay.
I hear okay. It's just this buzzing that goes on all the time up there. It never goes away.
I will definitely mention that as well. Okay. Thank you. That's good feedback. We don't know if people don't say something.
Arizona's horrible. And I have a very hard time hearing Trish. She's very soft spoken. And I have a very hard time at county board meetings, always catching it.
That's
And
good
I
to know.
could go up to the ear doctor. It could be my problem, not yours.
I'm just naturally a loud person, so.
Well, that's good. That's
Are
good.
we ready to adjourn?
Yep,
Because
I'm
I
ready.
have to leave.
All right. Number 14, I need a motion to adjourn.
I so move. This is Cindy.
Second,
All those in favor, please say aye.
I,
Aye.
And as a good friend of mine always says, if you oppose, you may stay.
Thank you, everybody.
Meeting is adjourned. Thank you.
Miranda, did you need anything from me?
I